So in this video we're going to cover what domiciliary care is and also how to set up a domiciliary care agency. CQC says that there are very important distinctions about registering as a domiciliary care agency and supported living schemes. By supported living they mean schemes that provide personal care to people as part of the support that they need to live in their own homes. Personal care is provided under separate contractual arrangements to those for the person's housing. Accommodation is often shared but can be single households. Supported living providers that do not provide the regulated activity personal care are not required by law to register with the CQC. However, most supported living schemes do register as domiciliary care agencies as well, because they do want to be offering the regulated activity, or it might be that it happens that at some point during the time that they are working with a service user they may need to be providing some kind of regulated activity. So setting up a domiciliary care activity or a domiciliary care agency as well is something that you have to be registered with the CQC, and they offer quite a lot of information on their website as to how you go about doing that, but also some of the issues, the values and the requirements that they have in place. It's important that you download some of the documents that we're going to put in your PDF. One of them is registering the right support and other best practices, and also Changing Our Lives, Quality of Life, the standard toolkit for you to download and read. That comes from the Centre for Welfare Reform. It really does help you to think about how you're going to start your business. The values that underpin all of this are about choice, promotion, independence and inclusion. If you start your company, your supported living scheme, your business, even the recruitment of your workers, with those standards and values in mind, then you are off to a very good start. So what does the CQC want from you? Again, I'll say they give clear guidance on their website, and they've got these documents that you can read. The first thing that they want to know how you will meet the Health and Social Care Act 2008 and the associated regulations, relevant guidance and any other laws that apply, what your training is and what your experience is. You must be able to show how you'll meet and continue to meet the fundamental standards that they ask for. You need to explain how you'll make sure your service is safe, effective, caring, responsive and well led. And they'll ask you about the regulations that you will have to put in your application. You will have to register a manager. That will be the registered manager, who will have to have relevant qualifications, current and up-to-date training in safeguarding, complaints, handling medication, consent, mental capacity, health and safety and human resources. They're going to ask for written proof of all of the qualifications that you have and completed training, and they'll want evidence that shows competence, skills and experience. The second thing that they'll look for are plans and procedures in place. The registered provider applications, that means that you as the provider will have to show that there are relevant qualifications, again current and up to date, written proof and completed training. You'll also need a business plan, financial forecasts, statement of financial viability, policies and procedures, quality assurance systems, and a statement of purpose. Your key staff must understand how your policies and procedures apply to your agency and help keep people and staff safe. You and your managers, and you might be the registered manager as the owner, you need to understand what is required of you under the Health and Social Care Act 2008 and the Mental Capacity Act 2005 and the Deprivation of Liberty safeguards. You must also have the qualifications, skills and experience to provide personal care that meets the needs of the people who will use your service. So, if you plan to act as the sole company director for the company or the provider, and or the proposed registered manager and or the proposed nominated individual, you must be able to demonstrate your fitness for each of these roles. Your premises are appropriate to deliver personal care is the final thing that they would want to be looking at when they inspect you and as part of your application, and you must include information about how appropriate your premises are. You have to show where they are in your application, and you need to have a plan to show how you're going to deliver care within people's homes, but you still need information about your premises. That's got to do with all sorts of different things, including confidentiality. So now we see that you do need to set up as a domiciliary care agency, and you will need to have it registered with CQC. So essential things to have in place are the right policies and procedures, get ready to pass inspections, and be registered. So there's a load of things that you need to do which are prerequisites for registration. You need to look at relevant qualifications and experience to provide home care. You need to satisfy the essential standards in quality and safety, and you truly need to be committed to the vocation of providing excellent standards of care that respect and enrich the lives of those you will be providing the service to. That is an important consideration which the CQC will look at as your registration process and also how you deliver your services. There's a little bit of a chicken and egg issue that goes on here. You actually will have to have your registered manager in place before you can offer a service. Well, that means that you'll have to recruit someone, if it's not you, to be acting as the registered manager, and they have to go through the registration process as an individual. So I've put together this handy flowchart for you about registration, just looking at the key elements. It will be in your workbook. You need to apply for a DBS. That used to be the CRB check. It's called now the Disclosure Barring Service. It ensures that you can lawfully work with vulnerable adults. That's the first action that you must take. Okay, the DBS checks carried out on the registered manager and the people who own the company, the directors, the nominated person. You need to get some references, and they need to be employment references about your career history, including your last employer, plus one from your GP. The GP one is to make sure that you are fit enough to provide this service. You need to fill in the registration forms, which you will get on the website, the CQC website. The forms do vary according to whether you intend to supply services as an organisation, a partnership, or as an individual. You need to fill in the registered manager's application. You must have a statement of purpose in place. The statement of purpose needs to be information rich to ensure nothing is left out. And information in the statement of purpose includes the details of the services provided, contact details, your aims and objectives. Once you've got your DBS, you're ready to submit your application. You can't submit your application before you've got your DBS. Okay, so I'm just going to briefly look at qualifications and training. As I said, CQC are really clear about what that is, but that's mainly around the common induction standards, and you will see those on their website. So for the registered manager, they need to have a qualification and competence at NVQ 5 and above, and the responsible individual also needs to have the experience to run a business. So here we've broken it down a little bit more for you, so you can see the registered manager's current qualifications. Registered managers have level 5 diploma in leadership for health and social care, or doesn't have level 5 but may have other things that will show that they have a diploma. Qualifications that are no longer offered but are still satisfying the CQC's requirements are the ones in blue. Finally, funding. Establishing an adequate cash flow is very important. Winning tenders is likely to be a significant element in securing income you need, and understanding the essentials of the process is one of the keys to success. So I've put together a little diagram here that will show you what happens in the processes of going for local authority tendering, and also filling in subsequent paperwork and receiving possible finances for your establishment to actually have a chance of working. Here we give this structure of what the local authorities look like, but we go into this in much more detail and also put it in your workbook so that that will help you. And this is really to think about the pre-qualification questionnaire which the local authority asks for people to submit for bids. And then you'll need to think about employing staff. So running a domiciliary care agency is very challenging. The logistics of providing care in multiple locations requires suitably qualified, trustworthy staff. When sourcing suitable candidates, you need to be certain about the required qualifications and experience, and you'll need to get support if you've never done that before. And finally, we've put together this checklist for you so that you can see all of the processes and parts that you need to go through in order to set up your business and also to start getting work and register as a company. And here we've drawn together information for you to use so that you can go and start your registration. It's all the relevant links to the parts of the website of CQC, and also information that will support you to get registered, get trained, and also recruit staff.